The silence of a fallen world is deceptive. It's quiet until your heart starts hammering against your ribs because you realized a rusty nail just gave you a death sentence. In the old world, a scratch was an inconvenience. Now, without a sterile ER or prescription pad, that same scratch is a 48-hour countdown to sepsis. Welcome to the grim reality of Victor's logic. Today, we aren't talking about thriving, we are talking about how to keep your blood inside your body and the bacteria out of it when 911 is just a dead dial tone. First, you have to stop the leak. Your cardiovascular system is essentially a pressurized hydraulic loop. Puncture it, and the fluid that keeps you alive starts spraying onto the pavement. Panic spikes your heart rate, which only pumps the tank dry faster, so force yourself to breathe. Grab the nearest absorbent material, a dirty t-shirt, a rag, headliner ripped from a car roof, and clamp it down on the injury. Do not be gentle, you aren't comforting a child. You are sealing a whole breach. Lean your body weight into it until the flow submits. Let physics do the heavy lifting. If the cut is on an arm or leg, hoist it toward the sky. Make your heart fight gravity to push blood to the wound. If 5 minutes of direct force doesn't staunch the flow, you need to escalate. Wrap that fabric tight. You want it snug enough to strangle the bleed, but loose enough that you don't necrotize the limb. If you see bright red fluid spurting in time with your pulse, you have nicked an artery. That's a 5-minute timeline to unconsciousness. Find the pressure point between the gash and your chest, the inner arm or groin, and crush that vessel against the bone to shut off the valve. When the tank runs low, the machine starts to crash. This is shock. If your skin goes pale and clammy, and the world starts spinning, your brain is cutting power. To non-essential systems, lie flat, elevate your feet. If you are truly out in the sticks, look for spiderwebs. It sounds like folklore, but clean silk webs are loaded with vitamin K. Ball them up and jam them into the cut to kickstart the clotting process. Inside your veins, a microscopic construction crew is laying down a fibrin net to catch blood cells. This biological barricade is fragile. Do not peel back the bandage to check on it. Every time you look, you tear down their work, and you reset the clock. Once the Red River stops flowing, you have to fight the invisible army. That open meat is a luxury hotel for bacteria, and they are checking in by the millions. You need to burn them out. Scavenge for high-proof spirits, vodka, whiskey, or antiseptic from a looted cabinet. Pour it straight into the trench. It will scream. That searing pain is just the sensation of bacterial cell walls disintegrating. If alcohol is scarce, turn to the ocean's chemistry. Saturate boiled water with salt until crystals stop dissolving. This creates a hypertonic hellscape where osmosis drags the moisture out of single-celled organisms until they implode. Soap works too. Its molecular claws rip apart the fatty envelopes of viruses. Scrub it, rinse it, and dry it. Now you have a clean hole in your body. You need to shut the door. If you leave it open, you're just inviting the rot back in. Your best friend in the apocalypse is cyanoacrylate superglue. It was used in Vietnam for a reason. Pinch the skin edges together, run a bead of glue over the seam and hold it until it hardens into a hard plastic shell. If you don't have glue, cut duct tape into thin strips and bridge the gap, pulling the skin tight. Like you're lacing a boot. If the gash is deep and gaping, you might have to play tailor. Sterilize a sewing needle and some fishing line or dental floss. This is embroidery for the desperate. Pierce the tough skin, pull the edges snug and knot it off. It is going to hurt, and it won't be pretty, but an ugly scar is better than a beautiful corpse. Now begins the wait. You've done the mechanics. Now you need biology and botany. If you see red streaks tracking up your limb, the infection is moving toward your core. Without pharmacy antibiotics, you raid the pantry. Raw honey is a distinct weapon. It generates low levels of hydrogen peroxide and dehydrates bacteria. Pack the wound with it. Crushed raw garlic releases allicin, a chemical scorched earth policy for microbes. For the pain, strip the bark from a willow tree and boil it. It's loaded with salicin, the natural grandfather of aspirin. It won't fix the wound, but it quiets the screaming nerves so you can rest. And if the flesh turns black and smells like death, you need the cleanup crew. Maggots, larvae of the blowfly, will eat only the dead, rotting tissue and leave the healthy meat alone. It is repulsive. It is medieval. And here at Victor's Logic, we know that it works. Sepsis is the endgame. If you get the fever and the shakes, the walls have been breached. Flood your system with water. Sleep. If you have expired antibiotics, take them and pray. You are not the healer here, your body is. You are just the janitor keeping the workspace clean so your immune system can do the job it was evolved to do. You plugged the leak, sanitized the site, and stitched the hole. The rest is up to your white blood cells. The world may have ended, but you are still breathing. You must keep it that way.